Chapter 8. COVID policies have increased deaths from cancer and heart disease. In response to COVID, hospitals and health systems suspended elective procedures, sometimes by order of governors and sometimes at their own decision, and have switched from in-person visits to telemedicine visits. Footnote: psychiatrists and psychotherapists have also mostly switched to counseling by video, which seems particularly unwise and unkind to me because most of their clients need counseling because of the loss of face-to-face contact with other humans because of our COVID restrictions. The primary thing the patients need is face-to-face interaction with a caring human being, which is the primary mission of psychological counseling. Yes, yet most counselors are refusing to give them that, either because their health systems will not let them or because the counselors are afraid, I think more than they should be, of contracting COVID. End footnote. In other words, we have basically discouraged everyone from going to the doctor for anything other than COVID. And when people insist on seeing a doctor anyway, we shunt them to telemedicine where they are less likely to be treated or diagnosed properly and certainly less likely to feel that their doctor cares about them. There have been many reports that cancer diagnoses are down in the U.S. That is not because fewer people are getting cancer. It is because fewer people with cancer are being diagnosed. That will ultimately lead to more cancer deaths. Fewer people with heart disease or other serious life-threatening illnesses are also being treated or diagnosed. A study estimated that in Great Britain there will be about 3,400 additional deaths for the four most common cancers over a 5-year period due to the excess missed diagnoses during COVID. Maringe et al. Projected to the U.S. population size, that would be 17,000 additional deaths. That is just the four most common cancers. Adding misdiagnoses of other cancers, heart disease, and other life-threatening conditions, the number of excess deaths would certainly exceed 20,000 and probably exceed 30,000. Relative to my estimate of 200,000 COVID deaths averted by our lockdown response to COVID, that would be 10 to 15 total excess deaths caused by misdiagnoses and forestalled treatment of cancer and other serious illnesses per 100 COVID deaths averted. In response to these facts, the health systems say it is the patient's fault. They say the patients are choosing not to go to the doctor because they're afraid of contracting COVID in the hospitals or clinics, and in some cases even have had heart attacks and do not go to the emergency room. There is certainly truth to that, and it is undoubtedly true that most of the misdiagnoses are because patients voluntarily have reduced their visits to the doctor. But the healthcare systems bear blame for this too. They have suspended elective procedures and discouraged in-person medical visits and tried to shunt patients to telemedicine. They've also gone along with promoting fear of COVID instead of educating people about their actual risk of COVID death, which is less than most people think it is, and promoting calm. Addendum 2023. It turns out I vastly underestimated the non-COVID deaths that the lockdowns would cause other than deaths of despair. The numbers for COVID and non-COVID deaths for 2018 to 2021 are shown below, references 2 to 5. In the addendum to Chapter 6, we saw that according to the CDC, there were 109,317 excess deaths of despair in 2020 to 2021 compared to 2019. The data above, that there were a total of 370,560 excess non-COVID deaths in 2020 and 2021 compared to 2019, means that 261,243 of those excess non-COVID deaths in 2020 and 2021 compared to 2019 were not deaths of despair. Footnote: the increased non-COVID deaths happened in 2020 and 2021 is quite a bit bigger than the 370,560 shown here. The reason is that the COVID dead were not available to die of another cause because they had already died of COVID. We saw in Chapter 2 that the median life expectancy of the people who died of COVID was less than a year. In other words, more than half of the 767,000 who died of COVID in these 2 years would have died within a year of something else if COVID had not killed them. Thus, if there had been no change in non-COVID death rates, the actual number of non-COVID deaths would have decreased by about 400,000 in 2020 to 2021, because about 400,000 people who would have died of cancer or heart disease or something else in that time did not, because they had already died of COVID. Thus, the true number of increased non-COVID deaths caused by the lockdowns in 2020 to 2021 is approximately 800,000, not 370,000. But I will just use the smaller number here. And since the increase in non-COVID deaths showed no signs of slowing in 2021, the actual number of Americans killed by the lockdowns will be over 1 million people. End footnote. We lost 2.4 years of life expectancy in 2021 compared to 2019. Life expectancy was 78.8, 77.0, and 76.4 years in 2019, 20, and 21, respectively. References 2 to 5. Using 11.8 years of life lost per COVID death, the number we found in Chapter 2 that is based on the age of the dead without considering that they were in poor health and actually had a lower life expectancy. The COVID deaths account for 1.1 years of that life expectancy loss. Footnote: 767,724 people died of COVID in 2020 to 2021, multiplied by 11.8 years of life expectancy lost per death equals 9.059 million person years of life lost. Divide that into 330 million people equals 0.0274 years of life lost per person in the population. To determine life expectancy lost, multiply that by the 79-year average life expectancy before COVID and divide by 2 years since the COVID deaths are for a 2-year period. And you get 1.08 years of life expectancy lost due to COVID, which I rounded to 1.1 years. End footnote. That leaves 1.3 years of life expectancy lost due to increased non-COVID deaths. A 1.3 year drop in life expectancy works out to 10.86 million person years of life lost due to the increased non-COVID deaths. I contend all of those increased deaths were caused by the lockdowns. Our leaders and the medical establishment decided to kill 370,000 Americans with an average life expectancy of 29 years in the hope that would prevent the deaths of 200,000 Americans from COVID with an average life expectancy of 4 years. And as it turns out, it did not prevent any COVID deaths at all. Incidentally, this also means that we lost more time of life to the people we killed by the lockdowns than to COVID itself. So the chart of prevented COVID deaths, if the lockdowns had prevented 200,000 COVID deaths compared to deaths caused by the lockdowns so far in 2020 and 2021, is shown below. As will be shown in Chapter 23, the lockdowns did not prevent 200,000 or any COVID deaths, and the non-COVID deaths caused by the lockdowns did not end in 2021. So the real situation is actually worse than this chart.